Welcome to Next Gen Parenting. Today, we are diving into an explainer that explores a really fascinating intersection: practical baby care tips inspired by ancient Indian traditions, perfectly blended with modern parenting wisdom and scientific safety. We're going to unpack these generation-tested remedies and see exactly what modern pediatrics has to say about them. Let's get started. But before we begin, we absolutely have to talk safety. Remember that these remedies are traditional practices commonly used in Indian households. They can provide amazing comfort, but they should always complement, not replace, professional medical advice. Always consult your pediatrician for persistent symptoms, newborn concerns, allergies, breathing difficulties, high fever, dehydration, or honestly, any serious medical condition. Your doctor is always your #1 resource. Okay, let's dive into this. Every single parent faces these common baby problems: colic, gas, poor sleep, mild coughs. Seeing your little one squirm and cry can be so incredibly stressful. But did you know that Indian households have been relying on simple, traditional remedies for these exact issues for generations? Today, we're going to discuss these common problems and some of the safe, traditional practices that families still swear by today. Here is our quick roadmap for today's explainer. 1. Soothing tummy troubles. 2. Comforting colds and coughs. 3. The magic of massage. 4. Traditional cosmetics and lead risks. And 5. Tradition meets science. Section 1. Soothing tummy troubles, gas, and colic. So, an infant's digestive system is literally just waking up. Swallowing air while feeding or crying easily leads to trapped gas. When we look at traditional Indian remedies, they're split into two very distinct camps. First, external care. This is an absolute must for newborns because, as we know, babies under 6 months should only consume breast milk or formula. So relief has to come from the outside, things like hing paste, bicycle legs, or tummy time. Then you have internal care, like ajwain water or curd. But those are strictly reserved for older babies whose guts can actually handle solids. A huge part of that external newborn care is hing, which is also known as asafoetida. It's a natural resin famous in Ayurvedic medicine for calming tummy spasms. But how do you actually use it safely? Well, you never feed it to a newborn. Instead, you make a warm paste. Just mix a tiny pinch of pure hing with a little warm water or ghee. Test the temp on your wrist, just like a bottle, and gently apply it in a clockwise circle right around the baby's navel. But please pay attention to step 4 here. Keep it completely away from the inside of the belly button, especially if that umbilical stump is still healing. Leave it for about 15 to 30 minutes, and then just wipe it away with a warm cloth. Now, if you'd rather use physical movement over herbal pastes, traditional practices have you covered there too. The bicycle legs exercise is honestly brilliant. You just lay your baby on their back and gently move their legs like they're pedaling a tiny bike. It naturally pushes trapped gas right through the intestines. Supervised tummy time is great too, because it puts gentle pressure on the tummy. And remember, try burping your baby frequently during feeds, not just at the very end. Oh, and a warm bath, perfect for relaxing those tense little abdominal muscles. For older babies who are already eating solid foods, we can start looking at internal remedies. Things like curd, buttermilk, and bananas are phenomenal. They act as natural probiotics that help digestion along. Another classic is ajwain, or carom seed water. You dry roast a half teaspoon of crushed seeds, boil them in water, strain it out, and you've got a mild, natural digestive aid. But keep in mind, this is generally only introduced once a baby is around 8 months or older and only in small amounts a few times a week. Section 2. Comforting colds and coughs, natural elixirs. When the seasons change and the sniffles start, Indian households often turn to some pretty amazing natural elixirs. 2 big ones are golden milk and tulsi kashaya. Golden milk, or haldi doodh, uses turmeric, which is famously anti-inflammatory. Pair it with black pepper and your body actually absorbs it much better. Then there's tulsi kashaya, a really soothing mix of Indian basil and peppercorns boiled in water. But we have a major safety warning here. While we adults love using honey for a sore throat, you must never, ever give honey to a baby under 12 months old because of the risk of infant botulism. I absolutely love this quote from pediatrician Dr. Manasa Mantravati. She points out that growing up with these exact natural remedies teaches us the value of supporting health holistically, and it perfectly captures why families love these traditions. It's a mindful approach that views herbs and everyday foods as a gentle first line of defense. Now, what's really interesting about this slide is the sheer creativity of some of these home remedies. Have you ever heard of putting a chopped onion in a baby's sock? In Indian home care, onions are actually thought to draw out a fever and absorb bacteria. You just wait until the onion turns brown and take the sock off. Or what about ajwain steam? Families will boil carom seeds in the baby's room to naturally clear up nasal congestion, totally avoiding putting direct, hot steam anywhere near the infant. It is so clever how these everyday household items are repurposed. Section 3. The magic of massage, touch, and bonding. We simply can't talk about Indian baby care without highlighting massage. In Ayurveda, this daily ritual is called Shishu Abhyanga, and it is about way more than just moisturizing the skin. Using warm oils enhances blood circulation, deeply relaxes the baby, and creates this amazing focused bonding time. Mustard oil has historically been used during the winter because it's considered a warming oil that helps with congestion. Meanwhile, cold-pressed almond oil is super rich and hydrating. Just remember, always patch test any new oil on a tiny spot of your baby's skin first, and stop immediately if you see any irritation. Section 4. Traditional cosmetics and lead risks. The science. All right, so we've spent some time on the deeply comforting side of these traditions, but modern science means we also have to step back and look objectively at the potential risks. Recently, researchers from UMass Chan Medical School ran a feasibility study at an Ayurvedic hospital and clinic in southern India. They tested 29 children to check their blood lead levels, or BLL, to see if there was any link between lead exposure and traditional medicines or cosmetics like kohl. What they found was that the mean blood lead level for these kids was 6.7 micrograms per deciliter. Now, to put that into perspective, lead is a potent toxin. Really, any amount of lead in the blood is a concern, but levels nearing or above 10 are a major red flag for developmental and neurological impacts. And this brilliantly illustrates exactly how those numbers broke down. Looking at the distribution across the 29 kids, you can see that while a lot of them clustered on the lower end, there were absolutely some outliers. In fact, 3 of the children tested had levels greater than 10 micrograms per deciliter, meaning they had to be referred for further testing and treatment. So the big question for the researchers became, where is this lead actually coming from? The survey results were incredibly revealing. Over 70% of the kids had recently used Ayurvedic medicine, and 55% used kohl. That's a traditional eye cosmetic often applied to babies to ward off the evil eye. Well, children who used kohl had a significantly higher mean blood lead level of 7.9, compared to just 5.5 for the non-users. Now, interestingly enough, in this specific small study, using Ayurvedic medicine didn't show a statistically significant link to higher lead levels. But the researchers were very clear that we definitely need much larger studies to draw any firm, long-term conclusions. Section 5. Tradition meets science. Best practices. So the crucial point is, how do we merge the warmth of these traditions with modern safety boundaries? It's all about a safety-first approach. We absolutely want to embrace the touch, the massage, and the family involvement that Indian parenting emphasizes. It is so beneficial. But we also need to set firm boundaries. Keep herbal remedies strictly external for babies under 6 months. Keep honey far away for the first year. Be highly cautious about traditional cosmetics like kohl because of the real lead risks. And always patch tester oils. Tradition and science, they don't have to be at odds. They can actually be a perfect team. At the end of the day, every baby is different. What works wonders for one child might do absolutely nothing for another. Traditional Indian remedies can provide incredible comfort, but they're part of a bigger picture. Because the most powerful remedy of all is still love, patience, attention, and connection. So I'm curious, which traditional baby care tip did your parents or grandparents use? Share your family's favorite wisdom in the comments below. And if you found this explainer helpful, make sure to subscribe to Next Gen Parenting for more insights into childcare and psychology. Thanks for joining me, and I'll see you next time.